I'm Dr. Hunter Waddell. I'm an orthopedic spine surgeon at the Spine Center of Louisiana, and today I'd like to talk to you about some of my special interest in spine surgery, specifically motion preservation surgery. So over the last 10 years, I've really seen how debilitating some of these spine problems that people have in their neck or their back can really be for patients. And so being able to perform some of these operations, whether it's an extremely simple surgery or a very complex operation that gets these patients back to doing those things that they want to do, is an extremely rewarding thing to be able to do as a surgeon, and is really an honor to be able to do that. In recent years, we've seen a big push as patients are wanting to maintain their activity level as well as their range of motion. And despite having a problem in their spine that needs surgery, they really don't want a fusion. Cervical disc arthroplasty has gained a lot of popularity in recent years, and it's important to know that not everyone is a candidate for that, but for people that are, it can be a great operation. We essentially use the same small 2-inch incision in the front of the neck on one side. But the main difference is that instead of using a bone graft and plates and screws like we would in a fusion operation, we'll put in a mobile bearing device that over time is incorporated into the bone once it's healed, and that allows patients to maintain their motion at that level. Similarly, sometimes you don't just have a problem at one level in your neck, you may have problems at 4 or 5 levels in your neck. And if you have the right indications and the right alignment, you can do what's called a laminoplasty, which is essentially where we go through the back of the neck with the same incision. And instead of putting in screws and rods to fuse those levels, we'll make some intricate bone cuts to create a bigger space for the spinal cord, kind of decompressing it in that way. And we'll hold the bones in that position with some plates and screws. We're not fusing it, but we're getting the adequate decompression that we need, and we're maintaining motion, which is great. My next real interest that I have in spine surgery is kind of complex revision lumbar spine surgery, where they're some of the most rewarding patients that I've been able to take care of, because they may have been bounced around from several clinics after they've had 2 to 5, maybe even more operations on their lower back. So these people, a lot of times when they come to the office for these multi-revisions, they've lost hope. These people have the simplest goals. They just want to be able to stand without pain in their legs. They just want to go to the grocery store. And whenever you can help them in that way, they're sometimes the happiest patients. So these are, 2 of my main interests in spine surgery, being motion preservation and complex revision lumbar spine surgery. But I handle the full gambit of spine surgery, whether that be in the cervical, thoracic, or lumbar spine. And if you feel like you have a problem that kind of fits within that window, I'd love to see you in clinic and just be able to kind of, sit down and talk through what your options are. And I'd love to take care of you.